My name's Aliya. I work at an organisation called Migrants Organise, and we are based in West London, and we work with migrants and refugees to organise for dignity and justice, and we support people, particularly those who are facing sort of the sharp edge of hostile environment immigration policies, to access dignity and justice. Yeah, the experience of our members has been very, very difficult during the pandemic. But I think, obviously it's important to foreground that with the situation of many migrants in this country is already extremely difficult. People live in an extremely cruel and arduous immigration system, which is, deliberately designed to often exclude people, marginalize people, keep people in that immigration system for a very long period of time, during which time people often have no right to work. They are housed in accommodation with a home office that's often grossly inadequate for their needs. Some of our members describe that housing as sort of prison-like situations. Some people are, have on visas with have conditions attached to them like no recourse to public funds, which means that they're not able to access any state support benefit. And I think, all of this is coupled with, not only are they also then, asked to live on an extremely small sum of money, around £35 a week, per person, but it's also coupled with this extremely sort of right-wing anti-migrant rhetoric and mentality that's sort of filtered through into, often our public services, in which there are questions around, making sure and questioning someone's entitlement to that service on the basis of their immigration status, which means that, people are racially profiled if they don't, look or sound British, and constantly asked to demonstrate that they, are entitled to support and treated with a hostility. And though I think, it's kind of that background against which the pandemic happened, that it needs to be considered. But when we consider like how difficult this time has been for different migrant communities in the UK. But there are obviously some elements of it that have made things particularly difficult for migrant communities, and particularly the hostile environment immigration policies, which sort of embed border controls into public services, have made things very, very difficult because people are very scared, and often rightfully so, to come forward for support, for healthcare, to access state benefits. Often many of them can't in the first place. And that's, led to people's situations worsening and not being able to access, support that other people might be entitled to because of their immigration status. One of our members wrote something for us in a blog, which I think was really powerful and kind of explains it, which is, she said, "We left our countries to seek a better life for ourselves and our families. Some of us made perilous journeys, risking our lives to seek safety and protection. What we want is a dignified life. Instead, we are not allowed to work or claim benefits. We are scared to go to the hospital or visit the GP if we are sick or showing any symptoms of coronavirus, as we might get reported to the Home Office and be forced to go back." And I think it's that fear of being reported to the Home Office, of potentially being deported, which exists even amongst those who have, status, and aren't undocumented or don't have precarious status. That means that it's been this period during lockdown, the constant fearing of authority, and not being able to access support and not knowing who you can trust to access support has made the situation, a lot worse. I mean, so that, there are so many different issues around this, right? Firstly, the advice kept changing, and for people who have, limited access to the internet, to computers, to radio, to TV, because if you're housed, in home office accommodation, often that stuff is very, very difficult to come by. And if you live on an extremely small amount of money each week, you don't always have phone credit on your phone. You aren't always able to get on the internet. So the constant changing of information around what the rules and regulations were was extremely difficult to sort of keep up with, and people didn't have that information. That information wasn't translated into different community languages for a very long time, and it actually fell to civil society, to charities, to sort of take on that work and communicate this stuff to our members and through our membership. And then at the same time, there was this fear around, okay, so finally you have the information that there are testing sites available, and you can get tested, or you can call 111 if you have symptoms. Um, People were really fearful about going to the testing sites. They didn't know if immigration enforcement would be there. It was something that was constantly repeated to us. People got told that they would need to take ID with them if they went to get tested, and people don't have that, often don't have ID. There was a lot of gatekeeping from people where they were in home office accommodation, where they were being told that they weren't able to go out to get testing. And when people had symptoms, people didn't know who to turn to. Because people were being told, the hospitals are full, you can't go into the hospitals. Alongside this fear of what if I go and my information gets shared with a home office or an immigration enforcement officer is there, or if I get charged for that, the treatment that I would receive. And I think this is then coupled with another issue around GP registration, which has, GP registration, there have been difficulties with ensuring that particularly hard to reach migrant communities who are undocumented or have precarious status are registered with the GP, precisely because they don't, if you get told for so many years that your data is going to get shared, or that, you could be charged for healthcare, you're not going to know that a GP is different and primary care is free, and actually there your data probably won't get shared. It's very difficult to separate all of that out. And so people didn't, know to go to a GP when they had treatment, or call a GP when they had symptoms, or call a GP when they had symptoms. And people weren't registered, combined with the fact that GP registration often, asks you again to have ID, proof of address, which many of our members, they don't. If you're in home office accommodation, you don't have proof of address. People have to move around quite a lot. If you are, undocumented, you have precarious status. You don't have that kind of documentation. Or, like with the Windrush. With the Windrush generation, what we learn is that lots of people just do not have the kinds of documents that are now needed to prove your entitlement to accessing things like healthcare. And it excludes people from going because they are fearful. And as many of our members report to us, it's very embarrassing if you try to go to a GP or go to hospital, get asked to prove something that you can't, and then get turned away and sort of essentially refused access to healthcare that you would need. So yeah, what we were seeing is that people were not, when they had symptoms, were not coming forward. When they, thought they might need a test, weren't coming forward. And this is despite, lots of reassurances and sharing the information that we could with people that fell to community organisations, civil society, charities, and others to sort of to do. And with really, really tragic consequences. An organisation that we work with called Kanlugan, it's the Filipino consortium. Many of their members, many of whom work in the NHS, but also some who work as domestic workers, as cleaners, and so on. Many of them worked actually sometimes in hospitals. They had members who weren't coming forward when they were sick. Because they so feared the hostile environment, they so feared their data being shared, and that endangering not only themselves, but also people that they lived with, potentially families being evicted. Again, this is part of what the hostile environment has contributed to, this criminalization of anyone who has anything to do with or might be supporting someone who doesn't have immigration status. And it meant that, unfortunately, there were people from Kanlugan in their membership who died of coronavirus without having sought any care because they were so fearful of hostile environment policies.